Hello, my friends, and welcome to Living Light. Today, we're going to be discussing a topic that is important to each and every single one of you, but is often overlooked when it comes to health and wellness, and that is the oral microbiome. Now, generally speaking, when we think of our oral health, we might think of the dentist. We may not necessarily think of the microbiology of our mouth. Today, we're going to be diving a little bit deeper into the environment in your mouth and how that impacts your brain health, your heart health, your gut health, your immune health, and of course, your dental health as well. What happens in the mouth goes everywhere. It doesn't just stay in the mouth. And I feel the mouth is a powerful window into our health that is very easily overlooked for cosmetic reasons, but there's an entire world that's happening at a microscopic level that we need to be aware of that we're going to be talking about today. So, just to give some background on this conversation, a few months ago, I was at an event called CellCore. It's called ECO, Exponential Clinical Outcomes. And I had a chance to meet my guest today, Dr. Jocelyn Strand. And she is just a firehouse of information, a powerhouse of knowledge, and somebody who I know you're going to love. And we just started talking about breathing and breath work and a whole bunch of other things. And I thought it would be wonderful to bring her on to talk about the oral microbiome because that's where she spends a lot of her time and energy and where she educates other clinicians like myself and also helps in terms of getting the information that her company has discovered out to the world. So without further ado, welcome, Dr. Jocelyn. Thanks for being here today.
Thank you so much. I'm really excited to be here.
Well, why don't we create some working definitions so our audience kind of knows where we're going with this. Let's just start off with the oral microbiome. What exactly is the oral microbiome and how does it influence our overall health?
Yeah, that's a great place to start. So most people know what the microbiome is and equate that to the gut microbiome. And sort of the easiest definition of microbiome is the bacteria, fungal, viral, yeast, all of the different microorganisms that exist in a certain part of the body. And so the microbiome and all of their DNA too, and their metabolites, right, can all be kind of lumped into that. So what are they doing? Which ones are they? How does it affect our physiology? Those are all things we think about with the microbiome. And the gut microbiome, of course, tons of attention, a ton of research, over 100,000 published articles in the last 20 years on the gut microbiome. And so now what we're realizing is that the microbiome exists everywhere on the body. We used to think the blood was sterile, the urine was sterile, the lungs were sterile, is what I learned in medical school, which I think is fascinating. But there is a microbiome and it varies from one location to the other. So depending on our immune interaction with it, whether there's good oxygen supply, there's all sorts of reasons why certain microorganisms will flourish in different areas of the body. So, I mean, the vaginal microbiome, even the prostate can have a microbiome. So really fascinating things we haven't thought about. So one of those, second only to the gut, is the oral microbiome. And that's an area where we typically see a pretty significant sort of total quantity of microorganisms growing.
Yeah, one thing for people to note, and I know you said this before we started recording is what we swallow in our mouth ends up in our digestive system. And so many health protocols that are designed to address microbial health are usually in the form of capsules. So
Mhm.
people might take capsules or they might take antimicrobials, whatever the case may be, to support a healthy gut microbiome, but your digestive system actually starts in your mouth. And
Exactly.
if we're just focusing on what's going on in the gut and not realizing that it could be potentially stemming from the mouth, we could be missing a key component to one's health, and they could be kind of reinfecting themselves or reproducing that dysbiosis continuously, and their treatments could be less and less effective. So I'm curious from your perspective, what would be some of the early or outward symptoms of an imbalance in the oral microbiome?
That's a great question. And just to sort of set the stage for those microorganisms, is that one of the most common producers of biofilm, which is plaque in the mouth. Like, this is easy. This is the easiest place for us to identify what is a microbial biofilm, because it's right here. It's the fuzzy teeth that we feel at the end of the day if we're eating too many carbs, maybe our stress is high, whatever it is that we have that imbalance. And so fuzzy teeth is a microbial biofilm mostly produced by two different microorganisms, a strep, which is a gram-positive bacteria, and then yeast or candida. A lot of people have heard of candida, and so in a single milliliter of saliva, we have 10 to the eighth. So I think that is that 10. Let me think about that for a second. 10 billion microorganisms in a single milliliter, and we swallow up to a liter of saliva every day. So just to sort of set the stage for how important it is, we are consistently swallowing these microorganisms. So I think the easiest sort of way to understand whether you have dysbiosis, which means an imbalance of the microbiome, where we're trending more towards microorganisms that are unhealthy for us, maybe in a number of different ways, and we can talk about the ways that they're unhealthy for us. But signs and symptoms, right, of how it might look. If you have fuzzy teeth by the end of the day, or if you brush your teeth and they get fuzzy right away, you have microorganisms that are overproducing plaque they use those biofilms to reseed themselves and continue to grow from those biofilms. So that's an easy first sign. Bleeding, when you have bleeding gums, when you're brushing or flossing. Now, a lot of people aren't flossing regularly, so the first time they go in, if they haven't flossed for a week or a month or longer, they'll have some bleeding because the tissue there has gotten really sensitive. But if you're flossing consistently, you shouldn't have blood on the dental floss when you're done flossing. So that is a symptom of sort of what we call friable or very sensitive or fragile tissue in the area. So those are easy ones. Of course, if you're consistently getting cavities when you go to the dentist, that's another symptom. And then we talked a little bit, you mentioned that we met talking about breath and airway in general is also, so if you have snoring at night or apnea at night, that can be an underlying cause of that can be microbial dysbiosis in the oral microbiome and the lung microbiome and the sinuses. So the lung and the mouth actually very closely associated, which makes sense if you think about it, that the two microbiomes might be closely associated, but we have the sort of suppression of our coughing reflex at night. And so we do this micro inhalation of our saliva at night. So another reason why lung health is why the oral microbiome is really important too. I went a little sideways there. I
No,
get
no,
excited.
I think it's really important for people to see, the connection. And I think the other area that it might show up in perhaps a little bit later is in the cardiovascular tissue. So do you want to talk about that a little bit more as well?
Sure. So there are a number of different ways that it can affect cardiovascular health, the microbiome in general. So we have the oral microbiome. When you have bleeding in your mouth, which of course we know happens relatively easily because it is pretty sensitive tissue there, there's a couple of things that can happen. You can actually get movement of the bacteria. So the bacteria, if we think about let me set the stage a little bit, is that we have a healthy tooth. If we have healthy gum tissue, it's sitting right adjacent to the tooth. And we will keep that cleared out with healthy immune system function, healthy microbiome. We'll have healthy tissue sitting next to the tooth. If we get pathogenic or microorganisms that are unhealthy for the body, and they get stuck down in between the gum and the tooth, our immune system comes in and wants to take care of it, but it doesn't. It does a lot of collateral damage in the process. And so you'll get that periodontal issues, right? So that looks like bleeding when you go to the dentist, and I missed this when I talked about it before, is if you have pocket probing depth that's too deep. That's a really important one as well. So what's happening down in those pockets is that we're getting collections of microbial biofilms. When you have bleeding and there's only a single cell layer between the gum tissue and the blood circulation at that level. So it's very easy if you get damage, you have leaky mouth if you're bleeding. Like that is the definition, right? We have a break in the barrier between the two of them. And so we can get movement of the actual bacteria themselves into the bloodstream, so that we know that when they do autopsies on people with heart disease, that they often have plaque on their in their arteries that contain microorganisms, most often from the mouth. And then you can imagine the immune system's doing the same thing in the blood vessels of the heart. It's in there trying to take care of it, but it creates inflammation and damage to the area. And that really is one of the causes of plaque formation in the heart, or it can be in the cardiovascular system. So that's a very direct route: mouth, blood vessels, heart damage. That's an immediate and easy one to understand. The other thing that happens, even if you don't have movement of the actual microorganism, is that you'll have these microorganisms that are producing sort of their waste product, and as part of their architecture for survival as well. They're producing things that are toxic to our body and create inflammation in the body. So you have movement from not just of the bug, but actually those what we call pro-inflammatory or inflammation-causing mediators from the microorganisms themselves directly into the bloodstream, which will just cause this sort of low-level smoldering across the body of inflammation. What I love about this is that this is an easy area to access, right? So
Mhm.
in terms of treatment, if we identify that something's going on here, it's an area that we can access relatively easily. So that's two of the ways that the oral microbiome can contribute to cardiovascular disease. The other, of course, we alluded to earlier, which is you're swallowing microorganisms. They can cause the same kind of damage in the gastrointestinal tract and cause sort of metabolic derangement. So where we have metabolic issues as a result of, again, that inflammation, damage to the lining of the gastrointestinal tract, it bogs down the liver and its ability to function, which plays a big role in our cardiovascular health as well. So a lot of different sort of ways that it radiates out and can contribute to or be a direct cause of cardiovascular disease. That was a long
Yeah.
answer.
No, that's great. And very important, right? Because cardiovascular disease is still the number one killer.
Mhm.
And when we think about chronic inflammation, that's the underlying fire that's burning inside most people that predisposes them to a variety of different conditions, whether it be hormone disruption, cardiovascular disease, cognitive decline. I mean, all
Yes.
these things are systemic and very much connected. I interviewed Karan Krishnan a few weeks ago, and one of the things he said is that the plaque is like a little skyscraper that the bacteria build in your mouth because they have a scaffolding structure. So there's
Mm-hmm.
actually a lot more, just like if you have like a square kilometer, but you build a condo on top of it, right? There's a lot more people that are living there than if you just
Yes.
had, a single layer of homes. So the fuzzy teeth is an early sign, right? Or maybe
Mhm.
a later sign in the progression of the problem.
Mhm.
What are ways that we can perhaps ask our dentist or evaluate our oral microbiome? Is there a way to do that? If let's say we don't have bleeding gums, we don't have fuzzy teeth, but we want to make sure that we're trajecting in the right direction, or maybe we do have those symptoms, is there a way to assess either at home or to ask our dentist to help us out?
It's a kind of a complicated. Well, what's complicated is testing. So there are ways that we can, with a clinical evaluation, we can check to make sure that we have healthy health. All of that. Do we have what's our pocket probing depth? Are we getting cavities? Are we, I guess all of those things that we think of. Are we when you go to the dentist, are they saying, oh, you need to come back every 6 months because of plaque? Are you going in and they're saying all clear, whatever you're doing is working? That's what we hear often from people, is sort of the marvel of, oh my gosh, I didn't even get any plaque between my last two testing, or two last dental appointment and this one. And so if all of that is going well, then I don't know that necessarily that you would have to. I would not advise any high intervention therapeutic at that point. And what I would say is you can always restore or maintain health in the microbiome. And what I think about in terms of conventional therapeutics is like things like conventional mouthwash. Is that right?
Mouthwash, yeah.
Like scope. Okay. Not that I'm saying anything negative about scope. But in general, a lot of a lot of the more conventional therapeutics are actually high intervention. So you may not think that. So let me explain what I mean when I say I wouldn't use a high intervention therapeutic. What I mean is that some of those rinses will have chlorhexidine or another component in it that actually wipes out the microbiome. So you may feel like you don't have fuzzy teeth, but you also won't have the beneficial microorganisms growing in
Mm,
your mouth as well. And that's important for a number of reasons, right? Again, inoculating the gut, but we also do a lot of our nitric oxide metabolism in the mouth. And I'm guessing that Kieran probably talked about that on his podcast or on the podcast as well, because he's so amazing with microorganisms. But you do want to make sure that you're using something that restores and maintains balance of the microbiome in the mouth. So a lower intervention therapeutic would be antimicrobial toothpaste, botanical toothpaste. So that's Biocidin. That's what we've got research ongoing right now. And actually, we have a case report published case report dropping with the two products. So the Dentalcidin and the Dentalcidin LS. So Dentalcidin is an antimicrobial botanical. It has 18 different herbs and essential oils in it. That is sort of powers both the oral rinse and the toothpaste. And the toothpaste also has other ingredients that make it a toothpaste, basically, and some additional herbs for oral health. But what we've done is the due diligence to make sure that we're not affecting the growth of the nitric oxide producing microorganisms, that we aren't suppressing over the long haul, that we aren't suppressing beneficial microorganisms. So we've been able to establish that both in the mouth and in the gastrointestinal tract, that these botanicals are a lower intervention way for us to just maintain a healthy oral microbiome. So that's what I would do. Or if you're more focused on dental, then you might consider a toothpaste that has hydroxyapatite in it that will help to maintain both the health of the dentin layer of the teeth and the surface layer of the enamel to prevent the breakdown and cavities in the teeth. So those are the things that I think of. And then, of course, which we didn't talk about, is all of the other things we do as practitioners to support healthy living. So eating a healthy diet, making sure you're actually chewing food, is a really important piece as well. So making sure you're eating fresh foods that take some a little bit of it's the same thing as doing lifting for your body, right? If you're chewing, then you're going to help with the density of your teeth, of your roots, and all of that. They'll be healthier, and true for babies too. So that's a huge piece that I think I didn't know when I had little babies, was they need to chew on hard things. None of those like squeezy packets, right? I mean, maybe one or two of those organic squeezy packets, but really they need to be like chewing on a carrot or something like that, so that they're developing all of their jaw and their teeth as well. And then, avoiding sugar, avoiding too much alcohol, all of the things, salud, all the things that we think of. And I don't know how deeply you want to go into that, eating a low inflammation diet, making sure you're getting enough sleep, that you address toxic relationships in your life, that your stress levels are low, all of those things as well. Very important aspect to oral health, not just whole body health.
Yeah, you touched on quite a few things there, and the one thing I'm curious about from what you shared is um, thermography. Does have you seen thermography kind of helping identify hidden inflammation in the mouth? I'm curious if that's something that's come up in your research.
So we haven't looked at that as a company, but I'm familiar with thermography, and I do know I've had patients who have used thermography to identify, mostly, is there a hot spot in the mouth, but then also tracing the lymphatic flow of that. And I'm sure that this must be why you asked, so I'd love to hear your perspective on it as well, but it can contribute to all sorts of other conditions, including breast cancer, if we don't have, because that's where the lymphatics from the mouth drain down the neck and into the breast. So, but I'd love to hear your perspective on that as well.
Yeah, a lot of people these days have root canals, which
Mhm.
is basically a dead tooth, right? That's in the body, and it can be harboring a lot of bacteria and creating some inflammation that doesn't just stay in the mouth, right? It can translocate
Mhm.
and become systemic. So I was just curious if there was any before and afters or anything like that you've seen. And if somebody does have a root canal, I would imagine that the biocidin would be very beneficial for them as a low level intervention. Or would you always suggest removing the root?
Well, I would always suggest removing the root canal. So I actually just had that done, which is interesting. So I'm in the midway through the process of getting an implant in one of my teeth, and it did get infected. And I know that's very, very common. Even so, we had research done by Dr. John Rothschild, who's a biologic dentist, with Dr. Lynn Patrick, who's an ND, amazing, brilliant ND in our educator in our community, and I think they looked at he looked at, you know what, I'm mistaken. He looked at crevicular fluid, which is the fluid in the periodontal pocket. But there's the other doctor, and I'm not going to remember his name right now. It just slipped my mind. Who worked a dentist who removed. He found 100% of the root canals that he removed were contaminated with bacteria.
Mm.
That again means this sort of smoldering all the time infection in the body. And so it's going to cause inflammation. And across the board, it will cause an elevation in inflammation. And so this is anecdotal, but when I first started working for Biocidin, maybe 8 years ago, I was working the care line, and I was talking to one practitioner after another about their clinical experience and helping them learn how to use the products. And on the same day, I had two chiropractors call in who told me that their root canal pain resolved with the use of the liposomal Biocidin, the Dentalcidin LS. So that has a liposome in it. So that the toothpaste is more superficial, but the Dentalcidin LS is a liposomal oral rinse, which means that it has the capacity to cross tissue, to cross across our own cells and act more deeply in the tissue, which is why we added that in a rinse. And it's not curative, right? It is only palliative, meaning that it will not treat the underlying cause. You will never be able to eliminate an underlying infection until you have that area removed. And the reason that happens is because when they do a root canal, they don't remove the periodontal ligament. And so the body thinks there's still a tooth there. And so it never comes in to do a full repair in the area. So when you get an explant of that tooth, they remove the periodontal ligament, and the body realizes there's a wound that needs healing and comes in and fills it in with bone. And so it's a very different therapeutic. You don't end up with area pockets where bacteria can grow. So long term, I know that there are people who do okay with root canals, who tend to tolerate them well and have great health despite having them. But it's not something that I would personally choose. So.
Yeah, it's such a very common intervention, and
Mhm.
as like people want to live longer these days, right? There's this whole push towards longevity and healthy aging. I think it's imperative that I would say we start with oral health,
Mhm.
because if you're swallowing a liter of saliva every day, you're just re-inoculating your digestive system, or your digestive tract, with these non-beneficial bacteria or potentially harmful bacteria. There's
Mhm.
translocation from the mouth that's going to, systemically through the blood vessels throughout the body, which can lead to, chronic inflammation, plaquing, cardiovascular events, all kinds of other things. And then the chronic inflammation can lead to a whole host of other challenges that are quite disruptive to our health. So,
Mhm.
it, you know, it's it's like a great place for people to start, and the intervention can be quite simple, right? Something as simple
Mhm.
as upgrading your toothpaste with the Biocidin toothpaste, and then
Mhm.
adding the Biocidin LS, which is the liposomal. Uh,
Mhm.
what maybe you could talk us through what a protocol looks like if somebody is using Biocidin.
Yeah, so for just the oral health, Biocidin itself is a glycerite tincture that was initially used this is a gross oversimplification, but initially used to treat the gut microbiome. That's where we sort of got our start. Was we were shown to that product Biocidin was shown to be active against a number, actually every pathogenic microorganism that they looked at it against for a stool test. So what's growing in the gut. So that's why we're sort of in the process of developing our science around the oral microbiome as well. But so the Biocidin is like I said, the main sort of the power in the Dentalcidin, and that just looks like replacing the toothpaste that you have. So that's an easy switch out. It's not another pill to take.
Hmm.
And then the oral rinse is just you use 2 to 3 pumps, and you can do it. So depending on what the needs of the patient or what the person using it is or are, it would be you can either do it twice a day, or you can, because it's sort of on the higher end in terms of price point, maybe you do it once a day or once every other day just to maintain balance, or you could do like therapeutically twice a day for a time. If you have bleeding gums and overproduction of plaque, you use it until you notice improvement there, and then you could come down off of it. So there is a quiz on the website so that you can determine which oral health products are right for you, depending on what's going on for you. So we put a lot of work into trying to sort of triage people into the right category so that you could get an optimized or personalized dental healthcare protocol or dental health protocol there. But sort of easy way to think about it, there are two toothpastes. One works the oral microbiome, and one works, that's the one with biocidin in it called Dentalcidin. And then there's Dentalmin Pro, which has the hydroxyapatite. So if you don't really have plaque production, you're like scoring 10 out of 10 when you go to the dentist, then that one is just like a daily maintenance for your teeth, for the dental health specifically. It does have some prebiotics in it as well. So it will help the microbiome flourish, the beneficials flourish. So my favorite pairing is the Dental Min Pro with the oral rinse, because then you're addressing both the microorganisms in the mouth, the deeper periodontal tissue with the rinse, and then you're brushing with something to maintain dental health as well. So I like the mixture of the two. So you're getting sort of broad spectrum
Yeah,
support.
that's what I've been doing. And the toothpaste tastes awesome. Even the oral, I mean the rinse tastes awesome. And I just had a quick
I'm
question
glad
for
you like
you.
it.
So when you use the rinse, do you spit it out or do you swallow it?
Yeah, rinse and spit. So you
Rinse and
rinse
spit.
it
Okay.
for 2 minutes, which can feel like a long time, but it just put it in your mouth. You can do it in the shower while you're in the shower. You can do it, I would floss first, because then you're addressing any microorganisms with the oral rinse that may be sort of mobilized from the flossing as well. So floss, put the oral rinse in, do whatever else you have to do for your day or for your bedtime routine, and then spit it out. And you don't have, it's actually probably better if you don't rinse. I said rinse, but that was an accident.
Okay. uh, and then you've said floss several times. What's your take on flossing versus using a dental pick?
I don't have a good solid take on the difference between those two things. I know that there are some people who think that flossing is only for removal of food particles and that's it. But I have other practitioners that I've talked to that are like evangelistic about flossing. So I am not a dentist, and I what we could do is we could seek that out with Dr. Ariana Ibrahimian, who's on our scientific advisory board and doing our research. We could ask her that question.
Okay, yeah, that'd be interesting to know. And
Mhm.
then, what are your take on tongue scrapers? Speaking of like kind of systemic oral health, what do
I
you?
think they're great.
Okay,
So yeah, I love tongue scraping. I mean, it's a little gross in the morning. I will say that. I mean, it's just a little humbling, I guess is what I would say. But the way that I would talk to my patients about it's like exfoliating for your tongue. It will
mm,
help with the health of the tissue. It also stimulates the growth of the microorganisms that are living in the rugae of the tongue. And the tongue is where the microorganisms that are responsible for nitric oxide production live, is in the back of the tongue. So if you pull all of that forward and give it, don't be shy about it, then it will help stimulate the growth of the microorganisms and the health of the tissue in that area. And there was something else I was going to add, and it has escaped my my mind.
well, I'm sure it'll come to you. If it does, just feel free to
Okay.
interject and share. It's interesting because we've been tongue scraping our entire lives. We just didn't know any different growing up. So that's part of what we've been doing and part of our culture for as long as I can remember. And I use a copper tongue scraper twice a day. Leaves your mouth feeling super fresh. I did not know that it impacts the particular bacteria that increases nitric oxide, but another huge benefit. So, tongue scraping for the win. I love that.
And that's what I
Um,
was going to say, is just to help people understand the importance of nitric oxide, is that and I need a lot of I could use education on that. But just to make sure that people, that's what left my mind. But it is that nitric oxide is really important for cardiovascular health, for the dilation of the blood vessels, so that our blood pressure is normalized. And that's just the tip of the iceberg for brain health. It's very, very important as well. And I would love, I don't know much more than that about nitric oxide. Sadly, it's an area that I could use some more learning, but.
Yeah, absolutely. So nitric oxide helps increase microcirculation. The hardest place to send blood flow is to the brain, especially the neocortex, because we're working against gravity. Nathan Bryant talks about this quite a bit. And one of the things that he says is basically all three forms of dementia can be addressed by, establishing healthy nitric oxide levels. So it's great for heart health, for brain health, but it's also very important for immune health because nitric oxide is anti-pathogenic and antibacterial. And that makes sense that our nasal mucosa is lined with nitric oxide because it's interacting with the outside world. We breathe about 30 pounds of air every day. And so if we're consuming that much air on a daily basis, we want to make sure it's filtering through and going through the right stages of filtration before it enters into the lungs. And of course, our mouth is the dirtiest part of our body. Our nose, it does the opposite. It cleanses and purifies the air before it goes into the lungs. And, it pressurizes the air, temperature regulates the air, moisture regulates the air. Nasal breathing acts as an antidiuretic, so it prevents dehydration as well. And it helps us structure the air before it goes into the lungs, increasing oxygenation by 20%. So something as simple as switching from mouth breathing, which about 50% of the population does, 66% at night, to nasal breathing will increase nitric oxide levels. And the thing that gets most people's attention is nitric oxide is very important for sexual health. So the way we breathe and the state of our oral microbiome plays a huge role in our sexual health, our blood pressure, our cognitive health, healing, repair, regeneration, and metabolic function as well. So yeah, we want to make sure we're doing whatever we can to preserve nitric oxide levels and enhance them as best as we can.
Yeah, very compelling. All of those things.
Yeah, there's actually studies that show people who use mouthwash, traditional mouthwash as antiseptics, are more prone to hypertension because it wipes out the beneficial bacteria that helps produce nitric oxide. And when we had this virus going around these last few years, all the experts were telling people to use mouthwash, which kind of wipes out the oral microbiome and wipes out their own ability to make nitric oxide. So it's like terrible advice,
Yeah.
creating, more dysfunction and inflammation for people.
I think that there was a strong link between the lung microbiome and outcomes during that period as well. So very fascinating, of course, very closely linked to the oral microbiome as well. So
Yeah.
interesting.
The answer is literally right under our noses, right? So you mentioned Biocidin, which is a company you work for, and they've developed a proprietary herbal compound that has botanicals in it that have been shown to work across a variety of different microbes and neutralize them. So we use Biocidin products in our practice when we encounter people with GI issues and challenges, and now we recommend the toothpaste to everybody. Maybe you could talk about a little bit more about the blend and how it was discovered and what are some of the local benefits and systemic benefits of it.
Sure, absolutely. So it is 18 plant extracts. 4 of those are essential oils. I think about it sort of like microdosing plants. That's how I feel about it because it's a dropwise dosing. It's very, very potent. So even like in pediatric patients, you can use a single drop. I used it in my practice for a baby with thrush, which is a problem with the oral microbiome, right? And so it is yeast overgrowth in the oral microbiome. So very easy, a single drop a day. So that is how one of the ways that I got introduced. It is actually the way I got introduced to this product is through needing something for pediatric dysbiosis because of the glycerite tincture makes individualized dosing very easy. But these botanicals, when used in combination, it was developed by Dr. Rachel Fresco. So she's an acupuncture and oriental medicine practitioner. She's retired now, but she developed this when she was working at Con Herbs. And it was, think about the activity as antimicrobial, broad spectrum antimicrobial. So that's the first thing. And that what antimicrobial meaning bacteria, fungal slash yeast, and even antiviral as well, which I'm not really supposed to say. So these are not claims, but these are the activities of the individual herbs, and the research supports that. So we think of antimicrobial breaks up biofilms. So that's an important aspect of this, is that the botanicals actually stop at every phase of biofilm growth. They interrupt that, both the growth, the adhesion of the biofilm to the tissue. They prevent or disrupt something called the efflux pump, so that they can't protect themselves from the other antimicrobial effects. So they're very active biofilm disruptor. And then we have anti-inflammatory effects. So when we bring down those metabolites and those microorganisms that are creating issue with our immune system, our inflammation will automatically drop. And we do have human clinical trials showing an increase in healthy immune activity shortly after using the throat spray. So you've tried the throat spray, right? You have the throat spray. Okay.
Yes, I do. I love it. It's great. It's in my travel bag, so I take it with
Mhm.
me everywhere I go.
We all travel with it, and it's got, so in the research, it was actually done on athletes who were doing high intensity training, and that is obviously very healthy for the body, but it's also stressful on the body, on the immune system. And so they measured those athletes, and they were able to see a 66% increase in the immune marker called secretory IgA in the mouth within 60 minutes of using the throat spray, 3 pumps of the throat spray. And so think about those ways of acting, right? So antimicrobial, antibiofilm, reduces inflammation, supports immune activity. This is how, once you understand how it works, then you select where you're trying to work in the body. So the dental products, obviously for the mouth, the liquid for the gut. Like we have a liposomal solution that's more systemic for systemic conditions as well. So really beautiful product for, I would say, very powerful, but a balancing, right? And so it's very different from like an antibiotic, which will come in and sort of unilaterally wipe out a whole class of bacteria, or an antifungal that will come in and wipe out all of the different yeast and fungal elements. There are beneficial yeast and fungal elements as well. So we don't want to wipe them all out. We destroy the balance, and then that's why people need probiotics afterwards, why they need this healing time after using an antibacterial or an antibiotic or an antifungal. With Biocidin, you sort of emerge from the therapeutic fully balanced, which is a beautiful thing. And we do have that. So, Dr. Or Nathan Bryan, right? Am I saying that right?
Yep.
Okay. I mean, he's a guru in this area, obviously in the industry. And I know he's expressed some concern about dentalcidin or biocidin potentially suppressing the beneficial microorganisms. And that is the question we get most often. Well, if it's killing pathogens, or the bad guys, what about the good guys? And that is why we've done the research that we have, is to look at total probiotic abundance and then the specific microorganisms. And what we've been able to establish is it doesn't increase, it trends towards an increase in probiotic abundance, but it wasn't statistically significant. But what we can say for sure is that, and this is with the blessing of Dr. Chris Dodamo, who's our research consultant, that it does not cause disruption in the microbiome, that it restores balance. So very exciting and different from conventional therapeutics in that way. So that you can tell I get really excited about. I'm very, very passionate about the Biocidin itself. Basically based on what I saw in my own practice, and feeling the need for people to have this in their hands and as a tool that they can use to stay healthy in their own life.
I love that. In speaking of the oral microbiome, are you also familiar by any chance with something called Perio Protect?
I'm not, I'm
Have you come
sorry.
across that? Okay. Um, that's okay then. We'll save that. We'll
I
save that
mean,
question for a
if
different
you
time.
know the ingredients, I might be familiar with how the ingredients work, but I'm not familiar with that product. So,
Well, so Perio Protect is a tray that people wear. So it's a custom-made tray, based on obviously the shape and structure of your teeth. And then there's a gel that you put in it, which I believe has, I think it might be 0.1% hydrogen peroxide, and there might be
okay.
other compounds in there. And that's supposed to have a antimicrobial effect. I'd be curious if there was any comparison or any research they've done
Hmm.
to see how that affects the beneficial bacteria, because it's not about having a sterile mouth, it's about having a balanced mouth.
Right.
Yeah.
Right. Yeah. I mean, I can't. Here's the one thing I will say for sure that we've noticed is that it's impossible to wipe out the oral microbiome, virtually impossible. And why do we know this? We know this because even when we use antimicrobials, the teeth are fuzzy again at the end of the day for most people, right? So even no matter what you're using, whether you're using something harsher or something gentle, it doesn't take long for those microorganisms to regrow. They have so many different little pockets of niche in the area in the mouth where they can grow, in the tongue, under the tongue, in the cheeks, up in the sinuses. It's just consistently reinoculating. And so really it's so important to focus on balance, because you're never going to wipe out all the bad guys. And if you just go in there guns blazing, you may wipe out some of the good. You will almost certainly wipe out some of the good guys as well. And you're actually, creating an uphill climb then for your immune system, which interacts with those microorganisms and the plants in plant-based therapeutics. So I just have a very strong bias in that direction to restoring balance. And to me, it's sort of what alternative care in general is more of, like, I would say, like nourishing, nurturing, rather than coming in like, take them all out, right? It's a
Right.
little more to restore balance and a little bit more gentle, and working with the body, calling the body into action, working with the human body. And we've been working with these plants. I'm sure you know this in the culture that you've come from, like with Ayurvedic medicine, thousands and thousands of years, our bodies have been interacting with these plants. They're familiar with them. They have a lot of the same pathogens we do. They have a lot of the same beneficial interactions with organisms that we do. And so they're a natural partner for us, the plants are, and we can call on their immune system as well. So it's just, to me, it feels like something smarter than me created all of that. Whether it's evolution or
Right.
creation, whatever your belief systems are, it's for sure smarter than my mind. Or any human mind, to me. And so I think some humility around it and leaning back into what have we done as a species for thousands and thousands of years that we know has worked, and plants are it,
I love that. Are there any contraindications to using biocidin that people need to be aware of?
I mean, I think just really basic things like if you're getting a surgery, you might want to come off of them for a little while. I did mention earlier, it is like microdosing. I've never had a patient have any kind of, sort of dangerous side effect or interaction with anything with this product. So, but everybody's different, and truly, it's so important to me to be humble about, nothing's unilateral for everyone, right? And so I think, the obvious ones, like I'm getting a surgery or I'm on a blood thinning medication, maybe you don't want to take a ton of the biocidin because it does have, or the dental cidin has CoQ10, like just things that will maybe cause some blood thinning around a surgery, just to be on the safe side. But no, I mean, I truly use this product, like I said, from newborns. I think the oldest patient I prescribed it for was 83-year-old woman, and she used the liposomal biocidin to treat chronic bladder infection, which allowed her, it totally restored her quality of life, because she had to catheterize herself. She had to be on long-term antibiotics. She was just miserable and didn't even want to be alive anymore. And so
Mm.
these are the moments why I get so evangelistic, or why I got so evangelistic about this product in general, is that I watched it work for people and restore their well-being. So the whole cradle to grave is what we used to say. We're probably not supposed to say that. But really, safe across the lifespan, and health span too. So the only caveat I would say is that, and I know you're familiar with the concept of die-off, is that if people are really riddled with microorganisms that are pathogenic or unhealthy, they can have a reaction when they start using these products as those microorganisms are dying off. And it's important to work with a practitioner if you find yourself sensitive in that way. And there are ways that can be supported. So.
Yeah, just maybe some binders or something that just helps pull these things out.
Yeah, so, and we're working. I also work with Cellcore now, and they have a whole slew of different binders. So that's another one, another area that can be a great support for gut health, for microbial die-off, all of that. So.
I love that. I could spend hours speaking with you, and I really enjoy our conversation. Is there anything that I should have asked you that I haven't asked that you wish more people would ask of you?
Oh gosh, what a question. Um, No, I guess, well, there's two things. One that's more sort of logistical about the oral microbiome is that in our research, one thing I think is fascinating is that the testing was really inconsistent when we were looking at the oral microbiome. So you may be tempted, oh, I have I have good oral health, but I want to check it out. So I'm going to get this testing done. And we did we did two different tests, a PCR, and a full genome sequencing. And these are two different kinds of testing. And we did two time point A of each. And they were very different from one another consistently. So there was no real consistent. What I think is that it can be very useful combined with clinical support. But I think that it's easy. This is my concern, or sort of the cautionary tale to me, is that if we see something, for example, if you do the full genome sequencing and it says something like, oh, your tooth decay is high. Well, that they're actually looking at bacteria that cause tooth decay, and you may have a lot of it, but you may never experience tooth decay. And I think people have a tendency to get really like tunnel vision once they see those test results, and they have to see it change, even if their health is restored or the health is perfect. And so I think be cautious around until we get better at the testing and really understanding the value of the testing. The clinical outcomes are what is more important than anything. And then the other piece is that I would say that's not at all related to the oral microbiome, except that I think it's a really important time in the world for us to take charge of our own health, to be taking responsibility for our own health and well-being, and to have the right tools in our toolkit. And that's all of the diet and lifestyle that I sort of sped through. And I'm sure that you support people on with this podcast all the time. But it's also, I think thinking for ourselves, taking responsibility for our emotional and spiritual hygiene, like what you do with the breath work was really powerful experience for me. Even just the two that I sat in when you did the breath work at ECO, I had a very powerful experience. So thank you for what you're bringing to the planet.
Thank you.
And if there's any way, so Biocidin, again, just a plug for it, aside from all of those things, is that it's in my medicine cabinet. And that's for acute tick-borne illness. That's how I use it, or for any kind of, I just like to have it on hand. You can imagine having a sort of an herbal antibiotic on hand that doesn't do all the damage. And so it's a good one to have in your toolkits in order to avoid or take responsibility for having what you need on hand. So yeah, that's the last piece.
Awesome. Thank you. I had one more question that popped up for me. And can the Biocidin products be used topically?
They can. They're a little bit sticky. And so a couple of things. If you have broken skin, I wouldn't use the throat spray because it's got alcohol and it will sting. But if the skin's not broken, that's an easy one because it will dry quickly. So you can do the throat spray. You can even do it in the ear if you have like an external ear infection after swimming or something like that, because the alcohol will help dry that. But the LSF, or the liposomal form, will, because of that ability to cross the tissue, is a better selection, even to add a little bit of water to it on your skin so that you're sort of activating the liposome with water, and massaging it into the area. So we have right now keloid case. We had one doctor come up at a conference in January who told us that similar to the teeth, which are a non-shedding surface, that's why we get fuzzy teeth, where we don't get fuzzy cheeks or fuzzy skin, is because our skin, everything else is shedding, but our teeth are not shedding. And so the biofilm can establish itself there. The same thing is true with an implant anywhere in the body. And so if people have hip replacement surgery or knee replacement, and this orthopedic surgeon came up to us and had used the liposomal topically and orally for a man who had an infected implant, and he feels it saved his patient's leg. So very exciting. So topical, yes.
Okay.
Even for eczema, it doesn't have to be an implant. So you
Okay.
can try it on anything. Yeah.
Oh, that's amazing. Well, Dr. Jocelyn, this has been amazing, as I would have expected. So thank you for, taking time out of your busy schedule and in educating and informing our listeners. I know Biocidin is available through practitioners, and my understanding it's also available online for people
It
to
is, yes.
purchase. Is there any need for someone to consult their practitioner first, or do you feel like, based on our conversation today, they can get started I know there's really no contraindications based on our discussion, very few or minimal contraindications, but it seems like it would just be a great place for anyone to start who's listening to this.
Yes, I think that especially the oral health products are an easy place to start. And then if you have something more complex, if you have long-standing gastrointestinal issues, if you have had exposure to mold or Lyme or anything like that, it always is helpful to you to work with a practitioner so that you're well supported. But for most people, this is an easy place to start. And there is the BioClear kit, or microbiome detoxification. That's an easy combination for people to combine the oral healthcare products with the BioClear program, and it has a booklet that's included that will help with dosing and why to use the products, how they work, all of that. And that includes the Biocidin and also a probiotic called Proflora and our binder called GI Detox. So that's a nice product that people sometimes use once or twice a year just to do a microbial reset. And if you do that and you notice that you feel different, then you know that your microbiome needs some work or some support. So I often use it as a diagnostic tool to assess in my practice how much effect is the microbiome having on this person's health. And so I would use the Biocidin. And if you do the kit and you feel better, it's one of the
Right.
underlying causes. Yeah.
Amazing. Thank you. Thank you. Thank you.
Yeah. Thanks very much.
My pleasure. Here's to amazing health and happiness to you and your family. And once again, appreciate your time today.
Thank you so much. Same to you, Dr. Patel.